10 health symptoms men should never ignore. We often put our health on the back burner, thinking it won't happen to me, but it's crucial to be proactive. Your health is your wealth, so let's dive right in. Alright guys, let's talk about chest pain. If you're experiencing chest pain, especially a crushing pressure or tightness that spreads to your arm or jaw, call 911 immediately. Don't try to tough it out. This could be a sign of a heart attack, and every second counts. Even if you're not sure if it's a heart attack, it's always better to be safe than sorry. Chest pain can also be a symptom of other serious heart conditions like angina or pericarditis. Ignoring chest pain is like playing with fire. You don't want to wait until it's too late. Think of it this way, your heart is like the engine of your body. If you heard a weird noise coming from your car engine, you wouldn't ignore it, right? You'd take it to a mechanic ASAP. Your heart deserves the same level of care and attention. Get it checked out by a doctor immediately. Next up, we're talking about shortness of breath. Feeling winded after a workout or a run is one thing, but if you're finding it hard to catch your breath even with minimal exertion, something's not right. Shortness of breath or dyspnea can be a symptom of various conditions, some less serious than others. It could be a sign of asthma, allergies, a respiratory infection, or even just being out of shape. But it can also indicate something more serious like pneumonia, a blood clot in the lungs, or heart failure. So how do you know when to be concerned? Pay attention to your body. Is the shortness of breath new or unusual for you? Is it accompanied by other symptoms like chest pain, wheezing, or a rapid heartbeat? If so, it's time to see a doctor. Don't try to diagnose yourself. You need a proper evaluation to determine the underlying cause of your shortness of breath and receive the appropriate treatment. Remember, your lungs are responsible for delivering oxygen to your entire body. Ignoring persistent shortness of breath is like slowly suffocating your cells. Get it checked out. Okay, guys, let's talk about weight loss. Now, I know what you're thinking. Losing weight? That's a good thing, right? And yes, if you've been hitting the gym and eating healthy, then absolutely celebrate those victories. But if you're losing weight without any effort and you're not sure why, that's a red flag. Unexplained weight loss can be a sign of a variety of underlying health issues, some more serious than others. It could be due to stress, a thyroid problem, an infection, or even something as simple as a change in your diet or medication. However, it can also be a symptom of more concerning conditions like cancer, diabetes, or malabsorption disorders. If you lose more than 5% of your body weight within 6 to 12 months without trying, it's worth getting checked out by a doctor. Don't ignore the signs. Get to the bottom of it and address the root cause. That nagging cough? It could be serious. We've all had a cough that just wouldn't quit. Maybe you had a cold that lingered a little too long, or perhaps you were battling a nasty case of the flu. But if you have a cough that's been hanging around for more than a few weeks, it's time to stop ignoring it and see a doctor. A persistent cough can be a sign of a variety of underlying conditions, some as simple as allergies or acid reflux, while others are more serious like bronchitis, pneumonia, or even lung cancer. The longer you wait to get it checked out, the higher the risk of complications. Pay attention to the characteristics of your cough. Is it dry or productive? Is it accompanied by other symptoms like fever, shortness of breath, chest pain, or coughing up blood? These could be signs of a more serious underlying condition. Don't fall into the trap of self-treating with over-the-counter cough suppressants. While they might provide temporary relief, they won't address the root cause of your cough. Ignoring a persistent cough is like ignoring a flashing warning light on your car's dashboard. Get it checked out and breathe a little easier. Blood in your urine, a sign you can't ignore. Blood in your urine, also known as hematuria, can be a sign of various conditions, some as simple as a urinary tract infection or kidney stones, while others are more serious like an enlarged prostate, kidney disease, or even bladder cancer. The color of the blood can range from bright red to a darker, almost rusty hue. Now, before you panic, it's important to note that not all instances of blood in the urine are a cause for major concern. Strenuous exercise, certain medications, or even dehydration can sometimes lead to temporary hematuria. However, if you notice it more than once, or if it's accompanied by other symptoms like pain during urination, abdominal pain, or back pain, it's crucial to see a doctor immediately. Don't try to tough it out or hope it goes away on its own. Early detection and treatment are key to preventing serious complications. Blood in your urine is your kidney's way of sending up a distress signal. Listen to your body and seek medical attention promptly. Erectile dysfunction, more than just a bedroom issue. It's more common than you might think, and it's not always just about what's happening or not happening in the bedroom. ED can often be a sign of underlying health issues that need attention. Now I know it can be embarrassing to talk about, but trust me, your doctor has heard it all before. ED can be caused by a variety of factors, including stress, anxiety, relationship problems, and certain medications. However, it can also be a red flag for more serious conditions like heart disease, diabetes, high blood pressure, high cholesterol, obesity, and even sleep disorders. The blood vessels in your penis are smaller than those in your heart. If something is affecting blood flow to your penis, it could be a sign that your heart isn't getting the blood flow it needs either. If you're experiencing ED, talk to your doctor. We've all experienced headaches at some point in our lives. Whether it's a tension headache from staring at a computer screen for too long or a sinus headache from a nasty cold, they're never fun. But how do you know when a headache is more than just a temporary annoyance? If you experience sudden severe headaches that come on without warning, especially if they're accompanied by other symptoms like fever, stiff neck, confusion, vision changes, numbness or weakness, or difficulty speaking, seek medical attention immediately. These could be signs of a more serious condition like meningitis, a stroke, or a brain aneurysm. Even if your headache isn't as dramatic, but it's persistent, recurring, or interfering with your daily life, it's worth getting checked out. Chronic headaches can be debilitating and impact your work, relationships, and overall quality of life. There are effective treatments available, so don't suffer in silence. Keep a headache diary to track the frequency, intensity, duration, and any triggers you notice. Seek medical advice and get the help you need. Testicular changes. Testicular cancer is most common in men between the ages of 15 and 35, but it can occur at any age. Get familiar with your testicles. The best time to perform a self-exam is during or after a warm shower when the skin is relaxed. Gently roll each testicle between your thumb and fingers, feeling for any lumps, bumps, or changes in size, shape, or texture. It's normal for one testicle to be slightly larger than the other. If you notice anything unusual, don't panic, but don't ignore it either. Most testicular lumps are benign, but it's always best to err on the side of caution and get checked out by a doctor. Early detection is key when it comes to testicular cancer, and the sooner you catch it, the better the chances of successful treatment. Remember, your health is worth it. We've all felt tired or run down at some point, especially after a long day or a poor night's sleep. But if you're experiencing persistent fatigue that lasts for weeks or even months, and it's interfering with your daily life, it's time to address it. Fatigue can be a symptom of a wide range of underlying health issues, both physical and mental. It could be due to something as simple as iron deficiency anemia, vitamin D deficiency, dehydration, or poor sleep habits. However, it can also be a sign of more serious conditions like thyroid problems, heart disease, diabetes, sleep apnea, depression, or anxiety. Don't brush off fatigue as just a sign of getting older or being too busy. Addressing the root cause can significantly improve your energy levels, mood, and overall quality of life. Mental health. Depression and anxiety are real medical conditions that affect millions of people, and it's crucial to break the silence and seek help if you're struggling. Depression is more than just feeling sad or down. It's a persistent feeling of hopelessness, sadness, or emptiness that can last for weeks, months, or even years. It can affect your energy levels, sleep, appetite, concentration, and interest in activities you once enjoyed. Anxiety, on the other hand, is characterized by excessive worry, fear, or nervousness that can interfere with your daily life. If you're experiencing symptoms of depression or anxiety, don't suffer in silence. Talk to someone you trust, whether it's a friend, family member, doctor, therapist, or mental health professional. There are effective treatments available, including therapy, medication, and lifestyle changes. Remember, your health is paramount. If you notice any of these symptoms, don't hesitate to consult a healthcare professional. Early detection and treatment are key to preventing serious complications and living a long, healthy life. Stay healthy and take care.